I'm Giacomo Luca in Gridley. It's a project 2.5 months in the making, but now FEMA is putting the finishing touches on a community for 400 families that will house campfire survivors. FEMA crews have cleared the 72-acre site, running underground electric, sewer, water, and paved roads in a project costing in the tens of millions, building essentially an entire neighborhood in just 2.5 months. Survivors will live in these 1 to 4 bedroom housing units that look like this. 300 have already been placed. They'll come fully furnished and will look similar to this inside. FEMA's project manager says crews have exceeded expectations because they know just how important it is.
They're not walking between trailers. They're running from trailer to trailer to jump on the next project. You know, and that to me is pretty amazing to watch that kind of enthusiasm to help get the project finished on that pace.
For the past 8 months, we've told you stories of those who have lost their homes in the wildfire and have since been living in hotels, shelters, or with family and friends. The first family will move in this afternoon and a majority over the rest of this weekend. Meanwhile, crews are ready to bring in the final 100 units to complete this project.
Tonight, Walmart stores across the country suddenly closed, supposedly a result of plumbing problems, they said. Tonight, Hillsborough County Commissioner, who worked with Walmart for years, says he has plenty of questions. ABC Action News investigator Adam Walser joins us live with what he's learned. Adam?
Well, Brendan, in Midland, Texas, which until Monday was home to one of the top 10 busiest Walmart stores in the country, the city building official told me his plumbing inspector was sent away when he offered to help secure permits. While the company claimed to have plumbing problems, a longtime employee of a tax service located in that store said she never saw a plumber or an out-of-order restroom in 3 years. Now, this was the scene at the Brandon Walmart Monday night during a 5-hour store closing sale. That store pays more than $243,000 a year in Hillsborough County ad valorem taxes and collects many times that amount in sales tax revenues. The store appeared to have been fully stocked with perishables when the sudden closure was announced. Fresh-cut flowers were on hand at the Tulsa store. The I-team has learned that no plumbing permits have been pulled in any of those cities. Permits in Midland, Texas showed that 70 plumbing fixtures were just replaced in an 8-week period 3 years ago. That store never closed during the renovation. Hillsborough County Commissioner Victor Chris says Walmart officials didn't even mention plumbing issues when they reached out to him to inform him that 400 people would lose their jobs.
It's really too early to tell whether or not there were mistakes made or there's issues to be held accountable for. But we're going to watch, we're going to look, we're going to listen, and we're going to make the appropriate steps if we see anything that is wrong.
Every official I spoke to said this week's action was extremely unusual for Walmart, which always notifies officials ahead of renovation plans and normally seeks permits weeks in advance.
Nebraska is beginning to play a part in dealing with coronavirus. Important to say right away, no one here is sick with it. Good evening, I'm Jennifer Griswold. Universities are suspending travel to China, and tonight we can tell you about a local quarantine site being set up for Americans returning from the Wuhan area. Reporter Ruta Olsenaida has an update on the virus and the prevention methods being put in place.
Ashland Fire has now confirmed that Camp Ashland will be used as a quarantine site for Americans returning from China to be monitored and observed for coronavirus. Under a federal health emergency order issued last week, U.S. citizens who have traveled to the Wuhan, China area recently will be subject to a mandatory 14-day quarantine. The CDC, UNMC, and federal officials met over the weekend to assess Camp Ashland and discuss details. As of now, we know around 70 people and a team of medical experts will be coming into the camp. UNMC's infectious disease specialist, Dr. Rupp, says quarantining likely healthy American citizens is still the most effective form of containment of the disease.
If we don't take precautions and we don't take this seriously, it can spread very widely, and we want to try to prevent that from happening in the United States.
Quarantining means individuals will be secluded from the general public in specific rooms. UNMC has recently opened their new 20-room quarantine facility as well.
That entity is up and running and ready if necessary.
The University of Lincoln, Nebraska has also made the decision to suspend travel to China for students and staff, affecting mostly study abroad programs.
We suspended travel to China after the Centers for Disease Control issued their level 3 warning on travel to China. That is a system-wide policy for the University of Nebraska, which would affect all of the 4 campuses.
There have been internal discussions at the University of Nebraska, Omaha, to follow suit.
Folks need to be concerned. They need to be aware. They need to start thinking about preparations, but this isn't anything that currently today in Nebraska or in the United States that somebody is at much risk of.
There are currently 11 confirmed coronavirus cases in the U.S., none of which are in Nebraska. Reporting in Omaha, Rudolph Sinaida, 3 News Now.
National Guard medics gear up to help staff the state's first and only quarantine isolation facility. Today, the Arkansas Department of Health shared more details with THV11's Vanessa Page.
We signed up to do this job, and it's just everything that we wanted to do.
Starting next week, 14 Arkansas National Guardsmen will be assisting with the only quarantine isolation facility in the state.
So we have come in basically to assist the staff that's already there. We are providing patient care. We are providing meals to patients.
They'll help with everything from supplying clothing and doing laundry. To providing 3 meals a day and monitoring patients' health.
It's just there. We're always ready to go. It's mainly just to help out with the community, just to help anywhere that we can in the state.
The Arkansas Department of Health says the facility was opened in an undisclosed location in March as a way to help people who don't have options to isolate.
If they are homeless and we provide opportunity to stay at the facility during their isolation and quarantine period. Also, it's meant for people who are living in a multi-generational house settings.
There are 29 rooms in the facility and there is no cost to patients. It's not a hospital, but doctors and medics do monitor people's conditions to ensure they're healthy before returning to society.
There are individuals who will put them in a private room. If they are family members, couple of them, we would put them in one room. So they all have their bathrooms and TV and all the amenities they need.
Tonight about the isolation facility we told you about last evening. More than a dozen Arkansas National Guard medics have been called in to help. Our Alexis Wainwright has been following this story. She's joining us now live with more of this. Interested to find out what you've learned, Alexis.
Well, yeah, no details yet on the exact location of where this facility is still tonight, Bob. Health officials say that's because safety is a concern for these patients. Now, what we do know is that it's near UAMS, and I talked with the Department of Health tonight. They say this facility is one of a kind for Arkansas, but some other states have something similar. Now, as you mentioned, medics from the Arkansas National Guard have been assisting with this. They're helping with staffing as well as transportation for some of those patients to get to the center. Now, the isolation facility has been functioning since late March, early April. They say they initially set it up to be prepared during the pandemic. This gives folks a way to quarantine away from their families if they don't have anywhere else to go. And anyone who is homeless can also stay at this facility. Now, on the other hand, it also helps health officials investigate, identify, isolate the cases, and do contact tracing. Health officials say that way they can hopefully stop the spread of the virus. They say so far 41 people have stayed there. I talked with one of the medical directors of the facility. He explains what exactly this looks like.
It is a 29-room facility, and it has 2 wings, and some of the rooms share their Jack and Jill bathrooms, but they all have their separate doors, locks, and things like that. So each room is occupied by an individual or sometimes a family.
Now, Dr. Bala says that food and anything else that someone would need while inside the facility will be provided for them free of charge. He says that they also have a discussion about making a second facility somewhere in northwest Arkansas if they need to get to that point. Now, Dr. Bala also let me know that they don't know how long they'll have this facility open, but as long as there's a need for it, they will let people inside of this facility.
Can predict how long this epidemic is going to last, and there are a number of scenarios that take us forward in time. I think the other question people are asking beyond how long is the pandemic going to last is how long are the shutdowns, how long are the lockdowns, how long are all the measures going to last, and will these measures be changed or be different? We are moving through an uncertain future. You see many countries around the world are just beginning the cycle of this epidemic. Some have been through the cycle of the epidemic, like Singapore and China, and are now desperately trying not to have the disease re-emerge and cause another wave of infections because of disease importations. So each country is in a different position, and Croatia is probably in a different position to many other countries in Europe right now. The real trick for countries is to look at the national situation, to look at the subnational situation, to see if you know where the virus is. If you know where the virus is, you can break the chain. If you know who has the virus, if you know who the contacts are, you can break the chain. If you have that knowledge, and if you have that knowledge at subnational level, you can only take action at the level at which you can measure. If you know what's happening in every town, if you know what's happening in every municipality, every county, every province, you can then begin to adapt your measures for the situation in that particular area. And all of us want to see the measures that we're using for public health at community level to be adapted to the maximum control of the disease, but to the minimum impact on economy and social life. And in order to do that, and in order to transition from the current measures that are in place, countries simply have to have in place a system to detect, isolate, contact trace, and quarantine, as well as to continue appropriate hygiene and physical distancing measures. They must be in a position to do that in different parts of a country at different times, and they must be in a position to re-implement measures should the situation deteriorate. That takes a very sophisticated surveillance system. It takes a very strong health system to absorb the surge of cases in any particular area. And what we need to do now is evolve from measures that have been designed to suppress and just take the heat out of this epidemic or pandemic to much more precise, targeted, directed measures that will allow us, at the very least, to live with this virus until we can develop a vaccine to get rid of it. Society-wide measures are difficult. They are not easy, and they are hurting people. But the alternative is even worse. And countries, if they're going to be able to move away from this approach of having to lock down and shut down, if we're going to move away from that approach as a means of suppressing the virus, we have got to put in place the public health surveillance, the isolation, the quarantine, the case finding, the detection. We've got to be able to show that we can go after the virus. because lockdowns alone will not work. But unfortunately, in some situations right now, they're the only measure that governments can actually take to slow down this virus. So what we're likely to see, if you imagine the lockdowns and the stringent measures that were put in place are now in place for between 2 and 3 weeks in Italy at different levels in different places, we should start to see a stabilization because the cases we see today really reflect exposures 2 weeks ago. It's a challenging situation for all countries in Africa, and the international community, I think, and for all countries of the South and low and middle income countries, need support. And the North must, while dealing with a massive crisis in its own regard, must move to protect the South, because nobody is safe until we are all safe.
We need to have a whole of government approach, because this pandemic cannot be arrested by just the health sector alone. We need to have all relevant sectors working together to suppress and control this pandemic. And not only the whole government approach, we're also saying we need the trust of the community.